Me now to take a deeper look at the reforms to China's healthcare system and the effort to recruit more general practice physicians is Dr. William Hsiao. He's a professor of economics at Harvard University's Department of Health Policy and Management. He's also an official advisor on health policy to the Chinese State Council. Welcome, Doctor.
Thank you. It's a pleasure to be here.
I want to begin and pick up on this story that we just heard about the efforts to recruit general practice physicians. Obviously, in many parts of the world, these are entry point physicians. This is where people access the healthcare system. Instead of using the emergency room, for example, what do you view as the benefits of having more of these types of doctors, especially when it comes to medical costs and the access for Chinese people, especially the elderly, to the medical healthcare system?
Definitely, family physicians is a benefit to the patients because they take care of the patients as a whole person rather than as specialists only look at one part of the patient's body or disease. So from the patient's perspective, that's definitely an advantage. And second, if the family physicians are available, then it's easier for them to gain access. And also, family physicians usually emphasize prevention rather than wait until patients get sick. So that's another advantage.
Which I would suspect could have a good impact on the cost of medical care if people are getting that preventative care, right?
That's correct.
I want to move now to some of the reforms. There have been reforms obviously announced back in 2009 to the healthcare system in China, as well as more recently. How would you assess China's progress so far in reforming its healthcare system?
China carried out a big reform in 2009. First, China trying to get just about everybody covered by health insurance. So up to now, 95% of the Chinese people are covered for basic health care, more than what the United States has achieved. And that's a big accomplishment. And second, China invested tremendous amount of money since 2009 to about $125 billion to build up primary care, including the training of family doctors and building clinics and so forth. Again, that's done, and so now people have access to primary care. Third is China established in 2009 a central drug list, and then doing bulk purchasing through competitive bidding and make sure a central drug is available throughout China. Again, that's a success. The fourth and last one is China wants to reform its big hospitals, particularly the tertiary hospitals.
These are the public hospitals, right?
And China, these are the public hospitals, and they are mostly dominated by specialties with the latest medical technology and so forth. But China did not know what to do because these hospitals have become driven by profits. They do not put healing the patients as a priority. Actually, the motivation is, how do I make the most profit out of this particular patient?
And so if I could just interrupt for a moment, Doctor. So one of the reforms we're seeing now is this effort to turn those public hospitals into more private-centered type medical care facilities, and that's a real opportunity for investors. I want to get you to talk about the opportunities for investors from overseas in this type of medicine. What are the opportunities there?
There's tremendous amount of opportunities. China wants to increase the privately owned hospital beds from 10% to 25% by end of this year. And China wants to increase the spending for health by the people from $520 billion to $1.3 trillion by year 2020. every year, in real terms, China intends to increase spending on health by 15%. That means expanding the supply.
So quickly, if I
Building
could just ask you to focus in on what types of, what are the best areas to get, if you had money right now to put into this type of health care, where would you be investing, doctor?
I would invest in tertiary hospitals, retirement homes, and also nutrition supplements.
Okay. Well, with that advice, we'll thank you for appearing on our program tonight. Dr. William Hsiao from Harvard University, thanks so much for your time and your insight.